Hello, everyone. My name is Catherine Grant, and I'm a communications coordinator at the Center for Celiac Research and Treatment at Mass General Hospital for Children. I'm here with Dr. Alessio Fasano to talk about celiac disease and the heart. So the topic of this month is chosen because February is American Heart Month. So it's really a great time to discuss, how to keep your heart healthy if you're living with celiac disease or a gluten-related disorder. So we're also going to take a few minutes to reflect on what we know about the connection between celiac disease and cardiovascular conditions, which, if you don't know, are conditions that affect the heart or the blood vessels. So, Dr. Fasano, have there been any studies done on celiac disease and cardiovascular conditions?
So, Katie, there are not, a large amount of literature on the impact of celiac disease or cardiovascular diseases. Like any autoimmune disease, celiac disease is a condition in which the immune system is activated, and therefore, in the long run, if not well controlled, celiac disease and other gluten-related disorders may have an impact also on the cardiovascular system.
Do these studies really have any evidence for this connection with the heart or the arteries?
Again, they do present evidence that a non-well-controlled disease can translate in inflammation of the heart and the vessels, particularly for people that are genetically predisposed to develop a cardiovascular disease. Of course, as you can appreciate, this condition are multifactorial. They have a genetic component, so you are predisposed to develop heart problems if somebody in the family had similar problems. Same story with peripheral vessels, but also lifestyle. And the most obvious, of course, is nutrition and physical activity, so that you eventually have a nutrition that favor the accumulation of fat plaques in your vessels, and that's reduce the diameter, and therefore the flux of blood is not optimal, and this can lead to consequences that can go from eventually easy fatigue because you don't have enough blood circulating your arms and legs, all the way to heart attacks and stroke.
Right. The studies that I've read about celiac disease in the heart and that I've come across, it really looks like the increased risk for coronary artery disease and other cardiovascular conditions is related to chronic and systemic inflammation. So can you talk to us a little bit more about that?
Yeah, I mean, not surprising, is not the only condition in which now we appreciate that chronic inflammation, non-infective chronic inflammation is, involved in the genesis of conditions like cardiovascular disease. This seems to be counterintuitive, but now we know that, cardiovascular disease, cancer, neurodegenerative diseases like Alzheimer's, they all have an inflammatory component. So it does not come as a surprise that this applies to cardiovascular disease as well. Now, if we accept that paradigm, it should not come as a surprise as well that if I'm affected by a condition characterized by chronic inflammation, i.e. celiac disease, and if this condition is not well controlled, you may have a bystander involvement of other organ or tissues that will be targeted by this chronic inflammatory process, including the cardiovascular system. All this to say that, going gluten-free and maintaining a strict gluten-free diet is not only a treatment for whatever symptoms you experience as the celiac or any other gluten-related disorders, but it is also a form of prevention of complications and comorbidities, in this case, cardiovascular diseases.
Right. That's really important to highlight that, the gluten-free diet does seem to decrease your risk of inflammation, which is not just isolated in the gut. It's kind of all throughout the body. It's very systemic. Really basic terms, can you explain to us what inflammation, looks like in the terms of the blood vessels?
Yeah, sure. I mean, the role of inflammation in cardiovascular diseases can be explained as one of the multiple factors that needs to be in place in order to develop, problems that leads to cardiovascular diseases. If you allow me the parallel, vessels, arteries, veins, and so on and so forth can be compared to big rivers. in which there is the flow of the river in the center that is very turbulent, and that's how the blood flow goes. But when you move to the side, to the banks of the river, so close to the side of the vessels, and then on their walls, those walls are smooth, and even if the flow is slower, but continue to be efficient. However, if they are inflamed, so you have a process of inflammation, let's say that you have celiac disease and that is not well controlled, and therefore your immune cells are fighting and creating inflammation also at the level of the vessels, that smooth flow will not be efficient anymore, because these banks will become sticky because there is inflammation, and stuff in the blood that travels, including fat like cholesterol and drop lipids, will stick in there because they like to stick there. And over time, these plaques become bigger and bigger until the sides of the river become smaller and smaller, and therefore the flow of the blood coming through is slowing down until eventually you reach the limits of the plaques to be so thick that the volume of the vessels in terms of the diameter will become practically clogged, and therefore the flow is stopped. And that creates a problem on the top where you have an increased pressure and can make this vessel to erupt. That's what happened, for example, with stroke, or a cardiovascular accident like an heart attack, or below when you don't have flow of blood that doesn't serve the tissues anymore, that this tissue will be not capable to be fed, quote unquote, by the oxygen, and therefore they can really get damaged, like all the way to the extreme of gangrene. So that's pretty much what's happening if you have any ongoing inflammatory process that associated to other factors like diet and sedentary lifestyle, that kind of stuff.
Right. That's fascinating. And it sounds like it's not a quick process either. It's something that takes.
Oh, no, this is a process. They materialize in years. No question about that. This is not going to happen in a matter of days or weeks. Nevertheless, again, and that, reiterate the concept of the fact that an inflammatory process like the one secondary to celiac disease that is with you for life, so it's chronically there, needs to be controlled by a good diet, and hopefully something else that will come in the pipeline in terms of treatment complementary to the gluten-free diet that minimize the risk that you will have an ongoing inflammation. That's something that we want to avoid.
When I was reading through these studies on cardiovascular, conditions and celiac disease, something that really interested me was that, the traditional risk factors for cardiovascular conditions like smoking and obesity and a really sedentary lifestyle, and a lot of these aren't present in a lot of people with celiac disease diagnoses, yet they still seem to be at a greater risk than people without celiac disease. So can you talk to us about why this might be?
Yeah, again, there are factors that definitely accelerate or increase the risk, but it's not that without those factors you can't develop the problem. For example, of course, you will develop lung cancer if you smoke 2 packs of cigarettes a day. Your risk is increased. But the fact that you don't smoke at all, you're not a smoker, doesn't make you immune from develop lung cancer. All this to say that, again, if we accept this inflammation theory, you can exercise, you can eat well, you don't need fat from animals that increase your chance to increase cholesterol, and therefore accumulation of the plaques in your vessels. In other words, you can do everything fine, but you have this underlying inflammatory process because your celiac disease is not quite controlled due to cross-contamination or other situation that rarely cheating, of course, because the vast majority of people with this condition, they don't cheat. But anyhow, any single time that immune system is put in motion and will create inflammation, it's not just the GI tract, the major target organ, that is affected by the inflammatory process in celiac disease to pay consequences. That's the battlefield where everything starts. But celiac disease is a systemic disease. There is no single tissue organ that is spared by the inflammation. There are people that have inflammation in the skin with dermatitis piriformis. There are people that have inflammation in the joint with the joint pain and rheumatoid arthritis or just arthritis that they experience as a consequence. The cardiovascular system is another target, and therefore it should not come as a surprise that you exercise, you do eat well, you are doing everything that you're supposed to do, and yet you can come down with this kind of situation if indeed there is a genetic predisposition and if the inflammation is ongoing.
Right. And you kind of just answered my last question, which is kind of what can people with celiac disease do to take care of their heart? So you mentioned, routine exercise and staying on their gluten-free diet and really, avoiding cross-contamination and getting sleep, drinking a lot of water, not smoking. But is there anything else that you'd like to add?
Well, again, honestly, the cardiovascular diseases, of course, are one of the top reasons of morbidity and mortality in humankind. No question about that. And what is really clear also, it's definitely among the most preventable conditions that you can imagine. We're not quite there yet to know how to prevent somebody to come down with a cancer, for example, other than general ideas. But when it comes to cardiovascular disease, it's pretty obvious what needs to be done. Maintaining a good weight, maintaining good exercise, eating well, because nutrition is by far, the most important thing. Eating well means, have plenty of fruits and vegetables, fruit, tubers, nuts, limited amount of meat, fish with omega-3 present. In other words, the Mediterranean diet, in other words, and eating and drinking plenty of water, as you were mentioning, are the low-hanging fruit, so to speak, intervention that we all should do to minimize the risk of developing cardiovascular diseases. For people with gluten-related disorders, on top of that, a stringent gluten-free diet that makes sure that your immune system is not fighting all the time and generate inflammation is another layer of intervention that you can make in order to really minimize the risk to develop these conditions. And I believe that, again, simple to say, very hard to implement for two reasons. One, because we tend to act when we have a problem. So we react and not prevent. So I have a problem with the heart attack. Now I take the Lipitor as a drug to limit the cholesterol in my blood, or trying to change my diet. That's not an efficient way to maintain our body healthy. Much more efficient would be to prevent, and therefore to act before that the problem is already on the table. Because when that happens, my therapeutic options now are limited. While if I do a preventive intervention, I have many more options to play with.
Right. And that's a good point, because especially with cardiovascular conditions, a lot of them aren't acute. They don't just happen. They kind of build up over time, over a lot of years. So it's better to try to prevent them. So that's
Yeah, and again, our goal is really increase the lifespan that we enjoyed, but in a healthy way. It would not be a great achievement if we, rather than live an average of 60 years, we live an average of 90 years, so 30 of which we have to live with cardiovascular disease that put us in major jeopardy in terms of the way that we embrace our lifestyle.
Right. Well, thank you very much for talking about this for February, American Heart Month. And I think this is going to be really helpful for people to hear. So thank you.
Thank you for having me.